Hi everyone, Sam here, licensed practical nurse at the Guildford location with Seniors ComeShare. Just want to talk to you about a common diagnosis with our seniors, which is diabetes, and how important it is to maintain your blood sugar levels. So first off, diabetes is a condition where people do not produce enough insulin. So typically insulin is a very important hormone that is secreted by your pancreas. Of course, it helps move glucose, which is a form of sugar, into the body's cells from the bloodstream. Once the glucose is within the body's cells, it can be used as a form of energy. So, needless to say, if insulin isn't available or doesn't work correctly to move the glucose from the bloodstream to the cells, it can stay within your bloodstream, leading to increased blood sugar levels. Okay? Some precursors or symptoms leading to diabetes doesn't mean it is your diabetic, but I do suggest if you have any of these symptoms, it can wreak havoc in your life. So I would suggest that you do make an appointment with your GP and just stress to them what is going on, okay? So I do have a picture. I hope you guys can see it okay. Of course, I'm more visual, so some symptoms leading to diabetes or a precursor of you having it could be frequent urination, wounds that don't heal, you're always hungry, always thirsty, you have numbness and tingling in your hands and feet, you may have suddenly lost weight, you may be tired, you may also have some sexual issues, and for women, some vaginal infections as well, and also some blurred vision. So there are some precursors. I do suggest you go and make an appointment with your doctor, okay? Like I said, doesn't mean you're diabetic, but it's just a telltale sign that maybe you should go for an assessment. So the two common types of diabetes with our seniors is type 1 and type 2. So type 1, it used to be a juvenile, they used to say, but now it can be diagnosed at any age. So pretty much is when your pancreas doesn't produce any insulin, or if that, a very minuscule amount. So then your doctor would have to prescribe you a substitute of insulin, which would lead to injections every day. And of course that would be prescribed to your body and everything else. Type 2, Type 2 is when your body isn't or your pancreas isn't producing a significant amount of insulin, but it could also be that your body isn't properly using the insulin to get the glucose into your cells, if that makes sense. So typically with type 2, your doctor would recommend or prescribe some oral medications, but I can't stress this enough. With type 2, I've even known some people that don't even have to take their oral meds because they are maintaining their blood sugar levels through diet and exercise, which is major in type 1 and 2, okay? So going forward, managing your type 1 diabetes, like I said, your doctor would prescribe you a daily injection depending on your body weight, your activity, your meal, like your ingestion of food intake and all that kind of stuff. And of course, to monitoring your blood sugar levels very regularly. And also that your doctor, depending on how well you have it maintained, will probably send you every 3 to 6 months for an A1C blood panel, just to see how you are maintaining your diabetes. Again, to diet and exercise and maintaining your insulin injections as per doctor, okay? That's type 1 and how you manage it. Type 2, like I said, your doctor, and in some instances with type 2, you may be prescribed insulin because it's just not working with the oral meds. But typically oral medications are prescribed according to your unique self and all that kind of stuff as well. And of course, like I said before, I can't stress it enough, weight control, exercise, and diet is major in type 2. Well, type 1 as well. Okay, so, and also too, checking your blood sugar levels, being type 2 at least twice a week, just to kind of see where you're at. And if you feel kind of off, I would suggest that you take it even more frequently. Also too, they would be sending you for blood panel for your A1Cs to see how you're maintaining your type 2 diabetes, okay? Again, I cannot stress this enough. Maintaining your blood sugar levels along with diet and exercise can help you prolong the chronic issues that is associated with diabetes. Some long-term health care problems with diabetes is neuropathy, which is major. The next time I see you guys, I will be talking more about the complications associated with diabetes, along with circulation and different types of movements that you could be doing even if you're sitting stagnant at home, okay? Again, can't stress enough, please check your blood sugar levels regularly and be on top of your diabetes, okay guys? Again, I'll see you in the next couple weeks, chatting more about some circulation and some diabetic foot care to boot. So I'll see you then. Stay safe and healthy, guys. Okay, see you soon.